Welcome to the Parent and Family Summer Content Series. This content is really for any KSU parents, families, support systems of our owls, but many of you may have heard about this series during our recent parent and family orientations, and we are excited to be with you today hosting another great campus partner, Student Health Services. And today we are joined by Dr. Noohani, KSU's new medical director. And I'm going to throw it over to her to further introduce herself so you can get to know her a little bit. Dr. Noohani?
Yeah, hi, thank you, Sharon. My name is Dr. Noohani. I am the medical director for KSU Student Health Services. I have been in practice for about 17 years with both primary care as well as urgent care experience. And for the last 7 years, I have been with Wellstar Health Systems, which is the partner that runs the Student Health Service clinics.
Perfect. I know probably a lot of our families are familiar with Wellstar too. It's definitely a common name in this area. So
Yes.
thank you so much for taking the time to be with us and our families today, just helping us all learn a little bit more in-depth knowledge about your department and services. I know that, during orientation, our friends in campus services get to touch on your area a little bit, but not as much as we would like. So I am thankful for this time together. So, I think to start us off, just give us an overview of your department and all your services and how those support our students.
So we are, very excited to share. We have 3 student health clinic locations, and we will be seeing students in person this fall, entirely in person. There was a brief period of time where we were telehealth because of the pandemic, but we will be very happy to see all students in person this fall. We've got 3 clinics in total. 2 are on the Kennesaw campus. They're located on each end of the campus. They're near university housing. And then we have another clinic as well that's on the Marietta campus that's located in the Rec and Wellness Center. And our clinics are staffed with board certified providers. We have 2 physicians and then a team of advanced practice professionals. And we also have a licensed counselor on site, usually located at one of the clinics. So, we're very happy to be able to provide that service as well. And we have been with KSU since about 2014. So we're really an integral part of campus operations.
Yeah, absolutely. I've been at KSU for 17 years, and I will say one of the things that I do love most about our kind of compact but also like really comprehensive campus is really how you all integrate with that. I think you're such a perfect example of how student health services, you're tucked away, but you're so comprehensive. You have so many services available to our students that are so important, and you guys are so easy to navigate too. I know a number of times I've sent students your way, and it's just so easy to tell them exactly where you are. And know, I've always felt so confident sending students your way because I know the level of care that they're going to receive is just going to be extraordinary. So let's dig a little deeper. Let's tell us a little bit about those services that you do provide to our students.
So we really, when your students are here, the students are here, we want to function as their primary care provider. We provide all the services that a traditional primary care provider would give, including acute visits as well as chronic care management. We do travel abroad visits, and we function, even as a travel clinic in that aspect. We also provide any immunizations that students might need. And we've also functioned as a facility to provide testing for COVID, or even vaccinations for COVID. If a student elects to do that, they can conveniently do that right on campus.
That's great. So really, any need a student has for primary care during their time, you all pretty much have them covered.
Absolutely.
Yeah. So, and we know, that at some point our students are going to need to visit the clinic. I think some students come in, they're like, oh, that's not anything I need to worry about or think about. But at some point in time during the year, we are all going to get sick, and we are going to need some care. So talk to us a little bit about how students actually go about accessing the clinics the best way.
So The clinics can be accessed in several ways. One is they can always call and make an appointment. Our phone number is 470-578-6644. Most of the time, they should be able to get a same-day visit. They can also go online, which sometimes for students is a little more convenient. So they can go to ZocDoc online, and then if they're already established with us, they have a MyChart account, which is basically a patient portal, so they can go online, schedule through that. If they've not seen us before, they will get that set up the first day when they come to see us for an appointment. So that's also another easy way. Once they have that MyChart account established, they can make an appointment through that. When they do come for their appointment, we ask them to bring their KSU Talon card, as well as an insurance card and their driver's license, which we will just keep on, file for any billing purposes.
Perfect. So they come into the clinic that first time, they get kind of all those things taken care of, and that's just on file from that point forward, unless anything changes. So that's great. Yeah, it's so funny. Yeah, students definitely making online appointments. Parents and families, I don't know. I feel like I'm an elder millennial, so I kind of like, I really kind of want to call, but I also might want to do online. So that's great. You guys have us all covered, no matter what our age. So let's talk a little bit about costs, because that's usually another thing that comes up with families. Once we know how to make the appointment, how much is that going to cost us?
So any student that's registered for in-person classes on campus, they've already paid the student health fee. It's a $51 fee per semester. It's included in their tuition, and it covers all office visits with our provider. So when they come see us, there's no charge for the visit. There's no copay. Anything that we need to do, for example, lab work, immunizations, that sort of thing, that will be billed to the insurance provider. For students who need self-pay pricing, we have that option as well. We don't have imaging services on campus, but if they were to need an X-ray, we have a really good relationship with Wellstar Imaging Center on Barrett Parkway. It's very conveniently located, and typically, we can get results within the hour. So there's a real benefit of our student clinics being affiliated with a large health system like Wellstar, because it's very easy to, provide those ancillary services.
Yeah, that's perfect. We are definitely surrounded in this area with such great additional options if we need them. So that's perfect. So got it. So if your student has registered for their classes, it sounds like a lot of worry of the payment is really kind of all taken care of.
Right.
And through that student health fee. So that's a good piece of mind for everybody. That that's the last thing you want to do when you're sick is try to fumble through all those types of things. So that's all taken care of. Now, another concern I'm thinking of, sort of behind costs and payments, is usually about medications. That's usually a question that we get a lot. So could you share with us a little bit about how your practice works with medications getting filled for our students?
So any student, if they know they're going to be needing medication refills, they're on a medicine that they take regularly, we recommend all the students, come early, establish care with us within the first month, so that we can ensure that we get their medicines refilled. Medications are sent electronically to any pharmacy in the area that the student requests. We do have the option as well, is that we can use a Wellstar retail pharmacy, and they can actually have a courier deliver their medications to campus. So that's definitely a convenience. As far as medications, we don't prescribe ADD evaluation or refills on those medicines. So if a student needs those medications refilled, we just recommend either they continue with their current provider for that, or have their provider refer them to someone who can do that here in the Kennesaw or the Marietta area.
Got it. Okay, great. So that's really, really good information to know. It sounds like really the best advice is talk to you guys sooner rather than later.
Absolutely.
Be organized so that we don't have any hiccups. And I love that there's so many options of getting those medications too, that you can do the courier. That's awesome. All right, well, let's shift gears just a little bit. Let's talk about, there's going to be everything we've talked about thus far. It seems very planned. We're getting things organized. Now, what happens when the plan goes unexpected? There's going to be, a sickness maybe in the night, after hours. We hope nothing like this happens with your student, but the reality is a lot of times we do get sick after hours. So let's chat through really what issues might arise and kind of how to take care of those things after hours.
So after hours, we have, in the rare case of an emergency, we hope that doesn't happen. But if a student ever has any questions about, something, if they're not feeling well, or they even have a question, is this something I need to go to the ER for? We have an after hours on-call provider, and they can call that main number. And then talk to someone in person, talk to someone live on the phone about their concerns. And usually we can help them decide. Most of the time it's something that we'd be very happy to see them for in the office the next day in the clinic. That way they can avoid an emergency room or urgent care visit if we feel like that's something that they can see us in the clinic for the next day. The good thing is both the physicians as well as the nurse practitioners, we all have experience in urgent care, acute illness type situations. So all of us are very well versed in counseling and talking to students about whether they need to go to the emergency room or urgent care. Majority of the time, though, we'll be happy to see them in the clinic the next day.
That's great. So our students really, I love that you all have such a collective experience of urgent care, number one. And number two, just knowing that number serves during the day, serves during the night. Yes. So really, not to throw it back to Ken Nugent, but one call, that's all. That applies here as well. So thank you for making it so easy for our students for whatever their needs are and whenever their needs are. So as we wrap up, let's address a little bit of an elephant in the room, right? A lot of times parents and families ask about privacy and kind of what can I know and what can I not know and why can't I know it? So tell us a little bit about privacy and how that works with student health services.
So the clinics protect student information under HIPAA, Health Insurance and Portability and Accountability Act, as well as FERPA. FERPA is more similar to HIPAA, but it's related more to college students. What our team recommends is that students share as much information as they want about their care with their parents, but they, understand that all of that information, anything that we discuss or that they see us for in the clinic, is completely protected and confidential, starting at age 18. And we're happy to discuss care with parents as long as we have the consent from the student. So we don't accept a blanket release, but on an individual visit basis, we're happy to share information as long as the students provided us with consent. In the case of an emergency, we'll contact the student's emergency contact. So I want to reassure parents that in the case of an emergency, they can have information that they need as long as they're the student's emergency contact.
Perfect. Families, much like I have encouraged you all, especially through my orientation discussions with you, if you have heard me there, I talk to you a lot about talking to your student now rather than later. And, specifically, we were talking about grades, right? So, if you're having that conversation, go ahead and fold in medical privacy and kind of how you all want that to work with your family dynamic. Talk to them. This is all really, it's new territory for you, but it's certainly new territory for your student, likely. That they're just kind of, you guys have made the appointments for them, and you might be in the room with them and those kinds of things. And so this might just seem a little bit, a lot different for them. So let them know you're here for them and you want to discuss these things and help them feel comfortable going into this new environment. And that, and I know our healthcare providers are open to, if your student gets in that waiting room or in that, that patient room and they're feeling like, I wish I could just call my mom and have her listen in on the phone right now. Just know that that is something that can be done as well. It's a transitional time. We begin to allow our kiddos to take charge of their futures, but knowing that this is a learning laboratory, right? We're not quite sending them off into the wild just yet, and knowing that there are some helpful and sweet and kind professionals in these clinics that are really just here to help your student. So just know that that's a great conversation to have. I think that'll be comforting for you and comforting for them. And I hope that that you can see that we've got lots of services and lots of caring people on the other end of this conversation. So as we close, do you have any final advice, Dr. Noohani, that you would like to give our families, just helping them best partner with you and your services?
I think I would definitely have parents just, encourage students to make sure they know before classes start where we are, so that they can come to see us, whenever they need us, as well as just making sure if they are going to be needing, regularly filled medications, that they don't wait till the last minute. And that they come to see us early so we can get established with them so that we, can refill all their medications on time. We're happy to have students come by the front office at any of our clinics. If they have a question, our front office staff is, happy to answer questions, take some time to talk to them. They can go online to studenthealth.kennesaw.edu. They can get detailed information about our team, our services. They can, access frequently asked questions. Our practice manager, Julie Fritz, her contact information is also on that page, and she's very happy to answer questions from parents or students. And we want it to be a great experience in our clinics for the students. We not only medically, but we want them to. We know that this is a learning process for them. They're learning to navigate healthcare. They're learning to do it on their own. Many of them have never have had parents do all of this for them. So we want to be a partner, not only in managing their health, but in, helping them understand and learn how to navigate, healthcare in general.
Wonderful. Well, and you all certainly have a jewel in Julie, if you will. She
Yeah,
is fantastic.
absolutely.
Family, she is just a wealth of knowledge and help, and absolutely, if you have questions, she can help you guys out as well. Well, perfect. Families, feel free to comment below this video if you have any other questions that come to mind while you're watching it. We covered a lot of things, but sometimes, when we're doing a recorded video, we're not live, so you can't quite raise your hand, but just feel free, pop that question in below the video, and we will definitely get those answered for you. Thank you so much, Dr. Noohani. Thank you, parents and families, for entrusting us with your student. And until next time, hooty hoo. Take care. See you soon.